live.
Dr. Koenig, please over to you.
Thank you, dear colleagues. Thank you so much for joining us for this roundtable discussion on the impact and response to heat wave in the African region. Slide, please. Let us go in few slides of housekeeping. Kindly note that this virtual session adheres to the code of conduct to prevent harassment, including sexual harassment at WHO events. Very, very important issue. For the questions and chat, kindly note that you may want to use the Q&A feature for questions regarding the topic and the presentations. Only questions in the Q&A will be answered during the session. Live questions will also be taken at the end of all presentations. And the chat feature is used only for questions that are regarding IT or logistics. So please take the right bullet before answering the right option to answer or to ask questions. Following slide, please. For the interpretation, be reminded that interpretation in English, French, and Portuguese are available by clicking on the interpretation button and click on interpretation and choose the language that you would like to hear. And to hear the interpreted language only, you may want to click on Mute Original Audio. Donc, pour l'interprétation, notez qu'on aura des interprétations en anglais, français, portugais. Et pour pouvoir écouter l'une des interprétations, il faut cliquer sur le bouton Interprétation en bas de votre écran et sélectionner la langue que vous souhaitez entendre. Et si vous voulez seulement entendre l'interprétation, il faut aussi cliquer à côté sur Arrêter le son original. Following slide, please.
Bonjour.
So we also have a live transcription. You may click on Show Caption and caption will appear on the screen. And if you want to close the caption, you also click on Hide Captions, as you can see it presented right here. Following slide. So for the recordings and material and feedback, kindly note that this session is being recorded, and we take your attendance as a consent to be recorded, and the recording will be shared after the session. The session material, including session recordings, will be emailed to the participant in the day following the webinar. So let's say hopefully by tomorrow, end of the day. And as we continue to improve our training programs, your feedback is invaluable to us. So a survey will be shared at the end of the session. And we highly encourage you to share your thoughts and suggestions. And your input will help us tailor our future session to better meet your needs and expectations. Following slide, please. And let's share a few words on the agenda. As you can see, the first 15 minutes will be for the introductions that we already start through this welcome remark and housekeeping. That will be followed by a first segment of the presentation related to understanding heatwave, the scientific evidence. And from this, we have two speakers from the Wits University in South Africa, Dr. Nicola Brinks, who is a clinical researcher at the Wits Planetary Health Division, and Professor Matthew Cherzis, who is a research professor at the Wits University, at the Planetary Health Division, Wits University in South Africa. This segment will be followed by a second one, focusing on the regional analysis of heatwave in Africa. And that this presentation will be made by Dr. Wasila Tiao, who is director of the International Office at the Climate Prediction Center at NOAA in USA. The third segment is made of three main components. This segment is related to preparedness and response to heat waves. The first component will be on preparedness and readiness. That will be done by Dr. Kawaya Tize, is a readiness assessment prioritization officer at WHO. And he will be followed by our dear Kitsensita Gigma, who is climate advisor at Hague and Burkina Faso for the Red Crescent. From those presentations, we will now move to the Q&A session, and where we will give the floor to participants for questions. And kindly remind that the questions that will be asked in the Q&A will also be answered here. But we may give the floor to some of our speakers, to some of our participants, mainly for translation issue. If we saw some questions in Portuguese, we may give the floor to this one to express themselves so that they got translated for the panelists. And we will end by closing remarks. So we hopefully expect to keep our roundtable in 1 hour and a half, with maximum 5-10 minutes addition if we have to go above. Having said that, let's now then move to the opening remarks by giving the floor to our dear Dr. Fiona Braca. I hope she's connected. I think I've seen it around. So I am giving the floor to Dr. Fiona Braca, Magdalena, who would like to come in. Over.
Thank you very much, Dr. Brahma, and good morning, good afternoon to everyone, colleagues and partners that have joined us today. On behalf of the directors of the Emergency Preparedness and Response Cluster and the Universal Healthier Populations Cluster here at the WHO Regional Office for Africa, I'm pleased that you could all make it today for this important discussion on a topic of growing interest in the African region. Several countries on the continent have witnessed unusually high temperatures this year. In March, a heat wave scorched East Africa and was especially intense in South Sudan. We are now witnessing the same in West Africa. In contrast to the heat waves, East Africa is now being affected by the El Nino heavy rains that have resulted in floods and landslides, with over 200 people that have died so far, majorly in Kenya, and over 500,000 people affected across Kenya, Burundi, and Tanzania in just the past couple of weeks. At the same time, Southern Africa is experiencing a prolonged dry spell during what is supposed to be the growing season, threatening food security. International world weather scientists have stipulated that these events are majorly likely due to climate change, and that climate change is increasing the frequency and the severity of natural disasters on the continent. WHO recognizes the immense responsibility to safeguard the health and well-being of the diverse populations across our continent, particularly in the face of increasing prevalent challenges such as heat waves. Heat waves are not merely discomforting episodes of hot weather. They represent a profound threat to human health, often exacerbating existing vulnerabilities and inequalities. As temperatures soar to unprecedented levels, our communities are confronted with a myriad of health challenges, ranging from health exhaustion and dehydration to more severe conditions such as heat stroke and cardiovascular complications. In addition, the impact of heat waves extends beyond physical health to mental well-being and to socio-economic stability. In general, heat waves in Africa have been associated with an increase in mortality and morbidity, particularly among vulnerable populations, such as the elderly, young children, and individuals with pre-existing health conditions. Health-related illnesses such as heat stroke, dehydration, and exacerbation of cardiovascular and respiratory conditions can contribute to hospitalizations and deaths during periods of extreme heat. In the African context, where many regions already grapple with limited access to healthcare, infrastructure, and resources, the consequences of heat waves can be particularly dire. Furthermore, rural communities that are reliant on agriculture and natural resources face additional challenges as these soaring temperatures disrupt livelihoods and they exacerbate food insecurity. The availability and the accuracy of mortality and morbidity data related to heat waves varies significantly across countries and regions due to differences in our reporting systems, our healthcare infrastructure, and the prioritization of heat-related health issues. As such, the true burden of those affected is underestimated. Since the beginning of January this year, countries across Africa, including Mali, Senegal, and Ghana, have issued alerts on extreme warm temperatures, underscoring the urgency of our response to this pressing issue. These alerts serve as a stark reminder of the immediate threat posed by climate change and the imperative for coordinated action to protect the health and the well-being of our communities. As the climate continues to heat up and country alerts evolve, we must mitigate an emergency of unknown scale. The roundtable discussion today serves to underscore the need for more knowledge on the science behind this area of work, the preparedness based on strong early warning systems, and the response options for timely interventions to mitigate negative health consequences. In our efforts to address these challenges posed by heat waves, we must draw upon the wealth of knowledge and the guidance that is available, including existing strategies from our health stakeholders to create the necessary and fine-tuned awareness on this topic. WHO literature, such as the Heatwave Early Warning Systems Guidance, offers invaluable strategic insights and recommendations for enhancing preparedness and response measures, empowering us to effectively mitigate the impact of extreme heat on public health. As WHO, we are committed to leading efforts to enhance preparedness and response measures across Africa, working in collaboration with governments, civil society organizations, and our international partners. Today, we have a real and pressing opportunity to create awareness on this topic with the presence of several professional experts with whom future engagements will continue. Colleagues, let us rise to this evolving challenge before us with determination, with compassion, and solidarity, ensuring that no one is left behind in our pursuit of a healthier, more resilient future for all. We look forward to the outcomes of this insightful discussion and what will be the next steps for action to safeguard the health of the African population. It's my pleasure to wish you all a fruitful and engaging session. Thank you very much, and back to you, moderator.
Thank you so much, Dr. Braka, for these brilliant welcome remarks. And let's then move forward directly with our first session presentation, our first panelist, Understanding Heatwave, the Scientific Evidence. And this presentation will be made by two persons, Dr. Nicola Brinks and Professor Matthew Cherzis. Both of them are from the Wits University in South Africa. So colleagues, Nicola and Matthew, the floor is yours.
Thank you, Dr. Kone. Good morning, everyone. My name is Nicholas Brink. I'm from the Wits Planetary Health Research Division in South Africa, and Matthew and I will be presenting on understanding heat waves, the scientific evidence. So in broad, we will be starting with defining a heat wave before looking at the factors that contribute to heat waves in Africa. And then we will take a look at what the work we're doing on the health impacts of heat waves and some current adaptation strategies. So I've been given the difficult task of defining a heat wave where, in fact, there is no universally accepted definition of a heat wave. The World Meteorological Organization gives us some guidance defining a heat wave as a period of marked and unusually hot weather that persists for at least 2 consecutive days. They mention that a heat wave is defined specifically according to the potential impacts on human health. Now, not all heat waves are created equal, and we need to look at different components: the duration of the heat wave, the heat hazard in that heat wave, and the area over which that heat wave occurs. And all of that will feed into guiding us into what the severity of that heat wave is. And that informs the impacts it's going to have on human health and what kind of adaptation interventions we need to be considering. The WMO did a survey of its member states and found that actually only 34 had definitions of heat waves. Of those, 20 used absolute values and 11 used percentiles. So perhaps above the 95th percentile for heat would be considered a heat wave. And this is usually relative to the hottest part of the year, which is why heat waves generally are only considered to occur during the hot season. Some countries use more complicated tools like the excess heat index, which rely on multiple parameters to see what the impacts will be. Some examples of these, if we look at Australia, for example, they use the complicated excess heat factor, and they grade their heat waves from low intensity, where there's a low risk to the population, to severe and extreme, where there's even a risk to healthy individuals. India, on the other hand, uses absolute cutoffs for different regions of the country, and they only have what they call normal heat waves and severe heat waves. If we use South Africa as an example, where I'm from, we also use absolute cutoffs, and you can see that that differs across the country where in our desert areas, a heat wave is only going to be classified if the temperatures are reaching above 40. And in our cooler interior, the temperatures can be in the high 20s, and it would still be considered a heat wave. So now if we move on to the factors that contribute to heat waves in Africa, there are essentially three things. The first is natural variation of weather patterns. The second are climate variations through things like the El Nino or the Indian Ocean Dipole. And importantly, we have to consider human effects, and that includes global warming, air pollution, and the phenomenon of urban heat islands. And if we look at global warming, we can see in this diagram from the IPCC, where in extreme warming situations, we're seeing periods of Africa where this dark purple here showing that there might be the entire year more than 300 days where the temperature exceeds that which is hazardous to human health. So now we can move on to the health impacts of heat waves. And if we use the WHO framework for understanding the impacts of climate hazards on health, we can see that heat waves operate through individual and systemic vulnerability. And some important climate sensitive health risks related to heat waves are mortality, directly heat related illnesses, respiratory illnesses, mental health, and the impacts that they can have on healthcare facilities. When we talk about vulnerable populations, we're specifically referring to the elderly, pregnant women and children, people with chronic illnesses, outdoor workers and athletes, and those who are socioeconomically vulnerable. Now, the reason that this vulnerability occurs is that when we're exposed to all this heat, the body tries to keep itself cool. And in doing so, it places an immense strain on the cardiovascular system. And if you don't have that reserve, you are going to be more vulnerable to the effects of heat. This was a study conducted in India showing that there was an increase of 33% on mortality by some heat wave definitions. And what you can see here is that starting from the left, with increasing duration of the heat wave, the mortality increases. And with increasing heat, the mortality increases. So if we have a heat wave that is relatively cooler and for a shorter period, you might only see a 10% increase in mortality. But if you have a very hot heat wave that lasts for more than 5-6 days, that's when you start to see the severe impacts on mortality. In Europe in 2003, there were 72,000 deaths reported from a single heat wave event. And from that, we can see that globally, over nearly 90% of deaths from extreme weather events are from heat waves. And this we need to consider in the context of where we're placing our emphasis on. And heat waves is certainly something we need to be considering as an important area. So I think contrary to popular belief, the deaths that happen during a heat wave, only a quarter of those happen from direct heat-related illness, things like heat stroke and dehydration. But in fact, the broader picture is that nearly 75% of deaths are occurring in vulnerable populations, and it is where there is an illness that's exacerbated by the heat wave. Now, death is not the only thing that's important. We conducted a systematic review on the effects on maternal health, and we found a 26% increase in the risk of preterm birth after a heat wave. And that is incredibly costly, and it increases the burden on healthcare beyond the obvious impacts to the individual. So now we can move to the last component of the talk, which is looking at what our current coping strategies are. When we look at adaptations, we always want to try and reduce risk. And we can understand this through the IPCC's vulnerability framework. And this incorporates the heat hazard, the exposure to that hazard, and an individual's vulnerability. So when we're looking at adapting to a heat wave, we need to realize that we need to prepare for these heat waves before they happen. And we can do that through climate adaptation interventions. You can see the figure on the right showing that simple things like improving ventilation, painting roofs white, providing green spaces, that is all background work that needs to happen to prepare us for heat waves. But when the heat wave hits, we need to start looking at grading the severity of the heat wave. And if the heat wave is not too severe, we can rely on things like early warning systems and sustainable cooling interventions, things that are described in the WHO guidance. But when we start to get to extreme heat waves, which are becoming more and more likely, we need to start thinking of interventions like declaring states of disaster, like we saw with COVID, where there was a severe limitation of activity. And we need to start looking at second generation cooling interventions, because sustainable cooling interventions might not work at these extreme temperatures. So just to give you an idea of what some current sustainable cooling interventions are, we consider things like fans, spraying yourself with water, immersing your feet in cold water, just drinking cold water. Those are all effective ways to cool down. But we note that there are limitations. When it's very humid, these things aren't working anymore. And when it gets very hot, they may not be effective. And I'd just like to point you to some really good additional resources. The Global Heat Health Information Network provides information on understanding heat, and it's really good if you'd like some more time in going through this. And the WMO and WHO guidelines on heat waves and health warning systems, as well as heat health action plans, are very useful. And I know I've just given you highlights of this component, so hopefully we'll be able to share these slides with you so that you can have a closer look.
Rama, can I just make two quick points? So just to add on to...
Just rapidly, Matthew.
Yeah,
sure. Yeah, very rapidly, please.
So I think just 2 quick points. The one is that when we make these definitions, it's very complex. So we need to think of what geographical area, what duration, what temperature cutoff. And when we do that, we need to link it to the health outcomes. So we need to know which health outcomes are important in one area. Next, my last point is that when Nick mentioned these extreme heat waves, and that's something we need to prepare for really, is that there will be periods of time when the temperature is above a threshold in which all humans can thermoregulate. And at that point, there's real risks of mass mortality events. And that is something that it's horrific, but I think it is a reality that we do need to think about.
Thank you so much. Thank you so much, colleagues. And did you just got 1 minute more, and that's perfect. And I know the first slide, how many slides you had, and I'm really happy that you were able to cut it to this one. So before moving forward, let me rapidly say that for our French colleagues, because for them to know that there is an interpretation, they need first to hear what I'm saying, so not so obvious. Pour tous les participants francophones, nous l'avons dit, mais nous le répétons parce que nous l'avons dit en anglais. Donc, si vous ne l'avez pas compris en anglais, peut-être que vous ne savez pas comment le faire. Vous avez une icône Q&A en bas de votre écran. C'est là que vous devez poser toutes les questions en rapport avec le panel, en rapport avec le contenu. Et la partie chat, c'est là que vous mettez tout commentaire adressé aux techniciens ou aux techniciens du webinaire. Tout ce qui est logistique et technique, vous le faites dans la partie chat, mais tout ce qui est question technique en rapport avec le contenu des présentations, vous le faites dans la partie Q&A. Donc, après avoir dit ça, nous allons maintenant passer au second panéliste. Et le second panéliste va donc nous faire une présentation sur les vagues de chaleur dans la région africaine. Il va nous donner une vue générale sur les vagues de chaleur dans la région africaine. Et ce panéliste, c'est Dr Wassila Thiaw, qui est directeur du Bureau international au Centre de prédiction climatique de la NOAA aux États-Unis. Donc, Dr Wassila Thiaw, je vous vois connecté. Je vous passe la parole.
Merci beaucoup, Brahma. merci de m'avoir invité. Je vais partager mon écran. Et je crois que... Est-ce
Oui,
que
c'est
vous
bon.
voyez mon
C'est bon.
écran?
Oui.
D'accord. Merci beaucoup.
Vous
C'est
êtes en
bon?
mode présentateur. Vous êtes en mode présentateur. Allez en haut dans le menu Display Setting que vous voyez en haut.
Oui.
Voilà, cliquez dessus et ensuite choisissez Duplicate Slideshow.
OK. Perfect.
Super, super.
Thank
Merci.
you. Thank you very much. Again, thank you for the invitation. My name is Wasila Cho, and I am one of you. I just happen to be working at NOAA at the Climate Prediction Center. And I'm going to talk about heat waves and what we do about heat waves. So heat is one of the leading weather-related killers in the world. We know that, and I say weather-related killers. The increasing frequency and intensity of extreme heat events mean that more people will be exposed to conditions that can lead to illness or even death, particularly among our most vulnerable population. So that is a statement, and this is really evidence of it. This is a time series of surface temperature anomalies from the 1800s to present. And this really show, the warming trend that we have been in for so many years. And we all know also that the global the global record heat was reached in 2023. And you can you see the further confirmation. Look at the global map, and you can see the places almost everywhere. Temperature anomalies have been positive with above normal temperature almost everywhere. And you can see Africa, certainly the central and eastern part of Africa, but also the eastern part of West Africa. Across the board, you can see that it has been warm almost everywhere. So after seeing the 2023 climate analysis, I have to pause and say that the findings are astounding. Not only was 2023 the warmest year in NOAA's 174-year climate record, it was the warmest by far. The warming planet means we need to be prepared for the impacts of climate change that are happening here and now, like extreme weather events that become both more frequent and severe. And this is not from me, it's from Dr. Sarah Kapnick, the NOAA chief scientist. And that statement is important because it really helps NOAA policy and what we are really doing in terms of heat wave. So as you can see with this warming, disasters related to weather hazards have been more frequent. We know that. And the number of people exposed to this risk are increasing due to population growth and also urbanization. And we know that heat is affecting more and more people, even in the developed world, even here in the United States. People are dying from heat every during the heat season. So, however, we have proven that multi-hazard early warning system can help. We cannot do much about the warming, but at least we could do something in terms of helping communities, population, reduce the risk of exposure and reduce the risk of heat-related illnesses. However, that requires a greater investment in comprehensive disaster risk management, ensuring that end-to-end early warning is given priority in any national and local adaptation and resilience strategies to climate change. So this is just a little bit of study here, just to show how heat waves have been increasing over the years. This is a time series looking at 3 stations in Niger. We could look at Mali, we could look at Senegal, we could look at other parts of the world. We'll see the same thing. So the conclusion from this slide is that heat wave is increasing in terms of number and also in terms of duration over the past few decades. So that's really telling. And this is something that will be increasing so long that global warming is persisting. So what do we do about that? We meteorologists have been running global model for a long time, and we have assessed the capability of our model to predict heat waves accurately. So as such, we are now capable of providing heat wave forecasts at many time scales, from 1 week to 2 weeks, going even to 3 weeks to 4 weeks. So that means that we can provide information to governments, local organizations, communities, to really start really issuing warnings and helping communities reduce risk of exposure and also risk of illnesses. So the map that I'm showing here are global heat hazard outlooks, valid for the period from May 1 to May 7, and also for the period from May 8 to May 14. Of course, the longer the lead time, the less confident we in the forecast, but at least it gives you some idea of what's happening, and maybe that information can be used to really take action. And this is coded such that when you have dark brown, extremely severe heat is predicted. Red means that severe heat is predicted, and orange means that high heat is predicted. And we're looking at least maximum temperature or heat index exceeding the 80th percentile. So that information is real time, on the time, all the time available and accessible. So next to it, we also have an interactive urban heat island alert system. And this is the web page that, that is available globally. So you go to the web page, you look at, you go to the menu to the left, and you click on any given station. When you click on that station, it will tell you what kind of alert we have for daily, but also at week 1 going to week 4. So you click on any of the stations here. For instance, you click on the station of Mali, the system will tell you if there is an alert. And anything that is coded on red for May 6, May 7, May 8, May 9, the system is issuing alert for Bamako, and that is not the case for May 10. So this is additional information that cities, localities can really use to plan. So what is the way forward? So the way forward is really collaboration between climate and health stakeholders to develop and effectively implement health impact forecasts. Because it's one thing to have these heat hazard outlooks operational, but it's another thing to make those forecasts actionable, and that's really where we're working on. So NOAA had been working with the Department of State and also USAID to support the President Emergency Plan for Adaptation Resilience that is prepared. And under prepare, we have a project called Early Warning System. So this is actually a United States contribution to the UN call Early Warning for All. So the scope is to expand and enhance early warning systems in the Caribbean, the Pacific Islands, and also in Africa. And the goal is to advance climate-based early planning and early actions. So our objectives to develop the capacity of institutions to implement and sustain early warning system through improvement of climate forecasts, co-development of impact-based forecast in heat, health, food security, but also flood-related disasters, and to develop a strategy for disseminating early warning and outreach. So we're really hoping that at the end of these projects, we'll work with institutions and government to really develop regional and national action plans to reduce climate-related risks. So in terms of the early warning system, this is the model that we're working with in terms of heat health early warning. So the schematic, which is really very simple, where we look at the forecast tool that we try to integrate with livelihood data that help us have a good knowledge of population vulnerability. So we bring the heat wave forecast together with the knowledge of population vulnerability through integration using geographic information system to issue heat health early warning bulletin and issue key messages that could be used for public intervention. So this requires collaborative work. No one institution can do all of this. So this is really a chain through which we can deliver a learning system by having the med services working collaboratively with the health sector. And when I talk about the health sector, I don't mean only Ministry of Health and medical doctors. I'm talking about, in broad term, community organizations, non-government organizations such as the Red Cross, to bring them at the table to really make sure that the forecast can be actionable. It also requires training of the stakeholders, both the meteorologists and also the health professional, in order to put this vision into action. So I'm sure that my colleague from Senegal will tell you a little bit more about this, but I just would like to finish here with this experiment that we're doing in the Caribbean as part of Prepare. And we just had a workshop there, 16 to 18 April, where we brought in 100 participants across the Caribbean, including the Ministry of Health, government, parliament, Pan American Health Organization, Red Cross, academia, NGOs. And we organized into breakout groups, and we came up with the prototype heat health early warning bulletin, which is shown on the left. So this is really the start. We are also working with Senegal, and I'm sure that my colleague can tell you more about what we do in Senegal. But this is just a contribution from Noah, and thank you very much.
Merci beaucoup, Wassila, pour la présentation. Sans plus tarder, nous allons passer à la phase de la réponse. Donc, comme vous l'avez vu, nous avons commencé par les bases scientifiques des vagues de chaleur. Nous avons fait une plus grande vue sur les vagues de chaleur dans la région africaine. Et à partir de là, maintenant, nous allons passer à la partie de la réponse aux vagues de chaleur. Et cela va commencer par une première partie sur comment on prépare la réponse. Comment est-ce qu'on est prêt pour la réponse? Et cette présentation donc va être faite par notre collègue docteur Kawaya Tizé, qui est responsable justement de préparation de réponse au niveau de l'OMS en ce qui concerne les urgences sanitaires. Docteur Tizé, à vous la parole.
Merci beaucoup. Thank you very much, colleagues, for extending the invitation to me. I'm Kawaya TJ. I support the Country Readiness Strengthening Department, and we work in collaboration with colleagues from the Health Security Preparedness and WHO, WMO Joint Climate Office that's in the headquarters here. So today, what I would like to do is just to try to focus on what the strategies for preparedness and readiness concepts and approaches that help manage heat waves effectively. I'm happy the previous speakers, Dr. Braca, Nicola, Matthew, mentioned some key points which are instrumental to preparedness and readiness. Just to highlight the nuance between preparedness and readiness, while readiness always is defined within the long-term health system strengthening, readiness always emphasizes on the imminent actions towards in response to the threat. So mostly readiness tries to complement the sustained effort already carried out through health system strengthening, which is the long-term work in preparedness. So readiness will always emphasize the rapid mobilization towards extreme heat in this case, and reinforcing the preparedness work. So mostly focusing on the work which preparedness is, which is mostly on the evidence that has been gathered over time, including historical data, data that has you derive from assessments and the long-term planning assessments. And overall, it improves coordination, resource mobilization, and crafting evidence, especially for fundraising appeals in response to the hazard like heat waves. So important, the importance of heat waves, preparedness and readiness for heat waves has been emphasized by a couple of colleagues, which includes population health and safety. Because of the consequences of this, vulnerable population has been mentioned to across elderly, children, pregnant women, and particularly during extreme heat events. So adequate preparedness and readiness really reduce both morbidity and mortality. A key component in preparedness is infrastructure resilience. So preparedness ensures that critical infrastructures like the power grids, the water supply systems, the transportation networks can withstand heat conditions. And this is something that we actually need to highlight as part of maybe regular maintenance in anticipation of extreme heat, upgrades and adaptation measures too, as I earlier mentioned by Dr. Tel. There's also the economic impacts we need to always prepare for to mitigate the economic losses. The community awareness and education as part of preparedness and readiness, where campaigns raise awareness about the heat risk and encourage individuals to take preventive actions. Educating the public to stay hydrated, among other anticipatory actions that is advised. One other component of the preparedness and readiness is the environmental considerations, because we see that heat waves actually exacerbates air pollutions and worsen existing disasters like droughts. And so while we are considering or follow our preparedness frameworks, it's important that we include sustainable practices to reduce environmental impacts of extreme heat. The overview of key components of effective preparedness and readiness include risk assessment and planning, early warning system.
Tize,
yes.
Can you let us know if you are moving your slide or not?
I'm moving the slide.
But we are still on the first one, introduction to preparedness and readiness.
Yes, correct.
Okay.
I'm on overview of the key components of effective preparedness and readiness now.
Okay, good.
Part of it, yeah. So, so the key components are the risk assessments, the early warning system, resource allocation and logistics, training and capacity building, as we are doing now in this particular fora, but we'll be more focused on other aspects like the healthcare professionals, volunteers, and enhancing mostly disaster management that includes first aid and crisis communication. And important parts, again, is the regular drills and exercises that improve readiness. Last component is community engagement and education. An addendum would be to add infrastructure resilience and collaboration and partnership, because this is a hazard that cannot be carried out by one organization, as earlier mentioned, as is multi-sectoral. And so we include both the community, the local authorities, regional, national, and share best practices. As Dr. Bracker mentioned earlier, there's no specific way of approaching heat waves, and they are very dependent and contextual on geography and vulnerability index. The policies that are needed mostly for both national and regional is existing policies like the CEDAR framework. It would be good for the approach to continue towards disaster risk reduction, trying to understand disaster risk governance, investing in disaster, and enhancing preparedness. Also highlight there's a Sustainable Development Goal 1.B, which provides sound policy framework to both national, regional, and international levels on how our approaches should be poor and gender sensitive in whatever strategies we are doing. The third would be the adaptation policy framework for climate change, which was developed by the UNDP on behalf of the Global Environment Facility. And fourth is a more dynamic and something that different countries are already applying in addition to the CEDAR framework is national and local disaster reduction strategies. And this is more applied to contextual and risk assessment that already exists. And a lot of member states produce the heat health action plan from this. So the overarching, I think all these frameworks will need to come together in order for us to have an effective heat response. Early warning has been echoed a lot of times and is a very important part of preparedness and readiness. And early warning mostly has been led here by the close collaboration between WHO and WMO. And given the frequency and intensity and duration of the extreme ambient temperature, we are now seeing excess mortality that still remains preventable. So early warning is mostly the key approach and to reduce this and increase capacity of health systems, because the earlier we prepare, the better capacity these health systems have and community residents actually have to effective response. Some of these components have been mentioned earlier, like the vulnerability assessments, and this is an important assessment that tries to define the population which is at risk. The addition of the geographic information system mapping is also important because of the topography. Heat risk is born out of combination of contextual factors. Is physical, geography, planning efforts, political priorities, and the creation of vulnerability through exposure to the heat hazard manifests different outcomes, depending on the location. So whatever it is that we are doing, this is the most important component. An important tool or tools the WHO have are the STAR, the SPA, the JEE, and the NAPS. These are tools that already define what capacities countries have. And when we have a risk, it's important that for any response, we tie it to existing tools before we define what our anticipatory actions are. Another tool that exists is the mass gathering tool, because extreme heat hazard is part of the hazards that happens when there's a large mass gathering. I add this link at the end of this presentation for further reading of this tool.
Thank you. So are you? Oh yeah, we are almost done with the time, but please go rapidly.
Yeah. So what we are doing now for the operational readiness aspects of the HEAT tool is providing 12 critical readiness capabilities for the threat, and they are tied to priority and anticipatory actions. So it's defined through all these frameworks. So we are working with across board with the climate, health, and change team, the preparedness colleagues that house the STAR tool, the JEE for capacities, and working closely, of course, with the Afro readiness team to make sure we finalize this tool as a matter of urgency. So this is just an outlook of the tool, and the summary and key takeaway from here is that preparedness and readiness requires mostly multi-sectoral collaboration. Early warning is always essential, and the strategic framework and contingency plan should incorporate gender equality and marginalized population overall. And yeah, thank you, and over.
Thank you so much, Tize. Rapidly, before moving forward with the next speaker, I can see a hand that is raised from one of the attendees. I just want to recall to your attention that any question you may have right now, please put it in the Q&A session. You can see down on your screen the Q&A icon. You just click on it and you put your question there, first thing. The second thing, we already start getting some questions coming in the Q&A session. I'm kindly calling to the attention of the panelists to go there and see whatever question they can already answer so that we got time when it comes to the Q&A session. Having said that, we will now be moving to the second component of the preparedness and response to heat wave. And we are glad to receive with us Mr. Kiswensida Gigma. I'm sorry, I hope I'm saying nicely the name, is a climate advisor for the Red Crescent, is based in Burkina Faso and in Hague. So dear colleagues, thank you so much for joining us, and the floor is yours right now. Over.
Thank you very much. The name is correct. It's Kiswensida Gigma, and I am a climate scientist with the Red Crescent Climate Center. So I'm going to talk about the initiatives that exist that could help address heat waves in Africa, of course. So as a sort of background, we know that heat waves are one of the most clear manifestations of climate change. And this has been visible quite recently in East Africa with what we saw in South Sudan, with also what we are seeing right now in West African countries like Mali, Burkina Faso, Niger, Senegal, and other countries. Unfortunately, for the specific case of Africa, despite the fact that we are certain that heat waves are having a lot of impacts on people, there is almost no reporting. There is a very insufficient number of reporting across the continent. And it may be the case that because of this lack of evidence, because of the lack of impact data on heat waves, also because of the competing priorities, because in addition to heat waves, we know that the continent is affected by other hazards such as floods, such as drought, with also some political instability here and there across Africa. This might actually be the reason why extreme heat and heat waves in general are neglected in Africa. And of course, because of that, the policies are not there. The disaster risk management strategies are not there to basically help people face this extreme heat and the impact that we are seeing at the moment. So we have two main strategies that are often recommended at the international level when it comes to managing heat risk. It is about, first of all, the development of heat health early warning systems. So these are, there is a document that the WHO has already developed conjointly with the World Meteorological Organization. I think that one of the previous speakers already elaborated a little bit about it. This will then save me some time. So it is basically a guide to support the national agencies, the national mandated agencies, to engage with all of the relevant organizations and, let's say, communities to develop an early warning system that will help them face the heat risk at different time scales. And in a typical heat early warning system, and we'll see an example right after this presentation from Senegal, we typically want, first of all, to have clarity on what is a heat wave in the context we are considering for a given country, and what also are the impacts and what are the link between extreme heat and health outcomes. And then we need to be able to know in advance when a heat wave is happening, where it is happening, and what will be the impacts of that heat wave. This is, let's say, the second major component of the heat health early warning system. But it's not just about knowing. We also need to disseminate that. We also need to get the people that need the information to access it in a timely manner, in a way that they will be able to understand, but also to act upon them. So dissemination is also a quite important aspect of a typical heat early warning system. And last but not least, there is also a need to develop a set of pre-agreed actions that will help individuals, but also communities, to take actions when they receive the warning. And unfortunately, as you can see on that map prepared by the Global Heat Health Information Network about existing heat health warning systems, you will see that actually in Africa, there is little effort on that at the moment. And actually, this map is about research that has been conducted, heat health systems that have been conducted, case studies that have been made. So it's not just even heat health early warning system per se, but this is in addition to other elements such as research. So if we're considering only heat health early warning system, we will see that in Africa, there is no more than 1 or 2 countries that have operational heat early warning systems. This is just a way to call out on all of us to see what can be done about this issue.
Excuse me, Gigma, rapidly. It seems that we have an issue with the translation in French. I hope it got resolved rapidly. Please go ahead.
Sure. And then we have the heat action plans as well. Heat actions plans are very great because they will cover all the time scales of what we call the disaster risk management cycle. So from preparedness to early preparedness, readiness, early action, early response, emergency response, and then the long-term recovery. So there has been a guide that has also been developed by the International Federation of the Red Cross and Red Crescent Societies and organizations, my mother organization, if you want. And I will go basically through the basics of that document, what cities can do to basically develop heat action plans that will help the citizens face extreme heat risk. First of all, there is a need to understand the heat risk at the level of the city. So who is vulnerable to extreme heat in the city, in our cities? Why are they vulnerable, and where are they exactly within the city? We also need to develop some kind of institutional framework of the heat wave risk management. So what organizations within the city or the country are responsible for conducting, let's say, the heat risk management? What coordination or collaboration mechanism need to be in place? For example, we need to get the Met services to speak with the water management agencies, with the power and energy agencies, with health systems, and etc. There is also the need to prepare. Now we are moving towards preparedness at the level of the season. So before the start of the heat season, I will take the example of West Africa. So as early as February, we may need to develop a set of action plan for the upcoming season. So what is expected in terms of extreme heat situation for the remainder of the season, and what actions needs to be taken by different components of the city. So the health workers, people working in water management, communities, and so forth. There is also, of course, the heat early warning system, which I just covered. So this should be able to provide timely and effective forecasts that will be used by different components of the city heat wave risk management components. And when there is an imminent heat wave warning, that is, when we know that in a couple of days a heat wave is going to happen, we also need to take a couple of actions. And these may include, for example, sending warnings, doing some public messaging, also addressing risk perception, because in Africa, many people still believe that heat waves are not an issue at all. It is very important to work on the perception, because otherwise a vulnerable people might not really understand the vulnerability and might expose themselves to severe risk of heat, and therefore have suffer the consequences later on. And during the heat wave itself, there are also actions that we may need to do at the level of the city. We can have, for example, the development of cooling centers. We can actually also have some individual actions like pushing people to drink as much water as possible, as well as some practical advices in terms, for example, of reducing the physical activity and so forth. After the heat wave has occurred, there is also a need to bring together all the stakeholders again to review what has been done, to draw the lessons, what worked quite well, what was not so well, and so forth. And in the long term, and this is very, very important, there is a need to readjust the urban planning for heat waves. And this will basically include actions such as readjusting the building construction strategies, doing more and more urban greening, like creating more green spaces in the cities, also encouraging a shift in terms of the roofs that people are using for the housing, like going for green roofs. Also, the hospitals need to be, let's say, climate or heat smart. I will come back to that in a second. The water, the energy management agencies might also need to develop some strategies to basically target the impacts of extreme heat on the sectors. So what concretely can be the role of the healthcare system, since we are in a WHO convened meeting? The healthcare system is very, very important when it comes to extreme risk management. They are contributing also, you know, probably to climate change. So there are a lot of things that they need to do. First of all, there is a need to upgrade the physical infrastructure of hospitals and clinics. We really need to have hospitals that are now heat smart, that are climate smart. We need to have hospitals that take into account the exposure of extreme heat of let's say the doctors, the nurses, and the patients, as well as the buildings themselves. There is a need to assist with the necessary public and health data analysis. One thing that is missing quite acutely in Africa, and which prevents heat action, is the lack of evidence. So we really need the healthcare system to provide the health impact data and the analysis that will help to show how heat waves can actually be kind of impactful to people, to various systems, and this could push decision makers and other relevant stakeholders to take action to mitigate the impacts of extreme heat. There is also the need to train more and more medical staff about the risk of extreme heat. This can happen at the level of the schools when they're being trained, but also right before the start of the heat wave, for example. There is also a need, of course, to keep the health workers, the patients, and the computer systems, as well as the medicines themselves, cool during the heat wave. And as I was saying, the health system itself contributes to climate change. So it might need to also mitigate the carbon, to reduce the carbon footprint. And this can be about using cleaner energy sources, better management of the waste, the medical waste, and using new technologies such as telemedicine and e-health.
Thank you, Gigma. Can you kindly go to the conclusion, please? Yeah, sure. We are out of time. Yeah, thank you.
Okay, sure. So lastly, international organizations like the Red Cross and NGOs can also take actions. And for that, we are advocating for anticipatory action. And finally, communities can also put pressure on the governments. They can do citizen science programs. They can help lead the greening of the cities. And of course, they can also do some community outreach. Thank you very much.
Thank you so much. Thank you so much, dear Gigma. Merci beaucoup. Et la présentation suivante, nous sommes déjà hors temps, donc on va aller directement à la présentation. C'est celle de Dr Ousmane Ndiaye. Dr Ousmane Ndiaye est directeur de la météorologie et de l'exploitation au niveau de l'Agence nationale en charge de la météorologie au niveau du Sénégal, ANACIM. Dr Ousmane Ndiaye, je vous laisse la parole.
Merci beaucoup, Brahma. Est-ce que vous m'entendez très bien?
Oui, on vous entend très bien.
Très bien, ok. Donc, je vais y aller. Merci beaucoup et merci pour cette invitation-là. Et beaucoup de gens ont déjà parlé de plusieurs choses. Je pense que je vais aller directement au but. Donc, ce qu'on m'a été demandé, c'est de voir aujourd'hui, on a vu la question, les définitions. Maintenant, est-ce qu'il y a des exemples pratiques, n'est-ce pas, au Sénégal? Rappelez seulement que c'est une réalité qui est là. Ce que je suis en train de montrer, c'est le nombre de jours chauds, n'est-ce pas, d'après les modèles. On voit très bien que l'Afrique est vraiment un hotspot. On voit très clairement l'Afrique est un hotspot. Donc, il faudrait qu'on fasse avec le changement climatique. Ça a été déjà dit. Voici un exemple en Afrique où on était en pleine chaleur. Vous voyez, personne n'est dans les rues. Quand on était au milieu de la journée, il n'y avait aucune activité, rien ne bouge, rien ne se fait. Donc, ce que disent les gens sont... Qu'est-ce qu'on a fait au Sénégal? Concrètement, tout le monde l'a dit, Dr Wassila, qui est un grand partenaire, l'a dit avant, il faudrait une synergie, il faudrait travailler ensemble. Ce qu'on a fait, notre système, comment ça marche? On a une prévision qui est faite par la NOAA, qui fait des prévisions à l'âge jusqu'à 3 semaines. Donc, on prend cette prévision-là et on essaye d'inclure une définition des vagues de chaleur. Et ensuite, on essaye de localiser un peu aussi les vagues de chaleur dans l'espace et dans le temps. Mais on ne travaille pas seul, on travaille avec le ministère de la Santé et avec d'autres partenaires, comme vous le voyez, local, national. On travaille avec l'environnement, on travaille avec le département de risque. Et tout ça pour permettre de voir ce qu'on appelle la vulnérabilité. C'est important de pouvoir définir la vague de chaleur en tant que telle, mais comment ça va impacter les personnes, ça qu'on est en train de faire. Donc, une fois que c'est fait maintenant, on essaye de développer maintenant cette vague de chaleur et de le mettre, cette vulnérabilité, les prévisions de risque, de la mettre sur une carte. Donc, une fois que la prévision est obtenue, on définit des seuils à partir desquels on peut définir une vague de chaleur. On a de l'autre côté une carte de vulnérabilité qui nous dit un peu où sont les populations qui sont les plus vulnérables, les vieux, les enfants, les femmes enceintes. Là où il y a un manque de facilité d'hôpitaux, etc., d'accès à l'eau, les gens qui sont loin des plages, qui sont loin des les métiers des populations, les gens qui travaillent en plein air en général, etc. On définit tout ça, on a une idée un peu où se trouve le problème. Et on essaye de mettre les deux cartes ensemble, définir une carte à risque, comme vous le voyez. Ça, c'est le Sénégal, ceux qui ne connaissent pas. Et on essaye maintenant de voir le Sénégal, quelles sont les zones qui seront impactées. Donc, ayant cela maintenant, on peut faire maintenant un bulletin qui sera diffusé. Et on le fait, comme je l'ai dit, avec toutes les organisations qui travaillent beaucoup avec nous. Maintenant, le bulletin, la composition du bulletin, je vous donne l'exemple du dernier bulletin qu'on a fait, qui couvre un peu la période du 1er au 7. C'est le dernier bulletin qu'on a fait, le bulletin numéro 7, depuis qu'on a lancé la campagne de vaccination. Et vous voyez très bien que le bulletin est très clair. On a la carte du Sénégal et on localise les zones. Et on dit comment les vagues de chaleur seront sévères, seront impactées les populations. Quand la couleur est rouge vers le foncé, ça montre que vraiment il faut faire très attention. Les gens sont à l'intérieur un peu, loin des infrastructures. Et quand on voit un peu à la plage, on voit très bien que la bordure, qu'on voit que c'est moins grave, etc. Le système de couleurs qu'on a. Et on définit en bas qu'est-ce que ça signifie. Concrètement, ces couleurs-là, qu'est-ce que ça signifie. Donc là, c'est connu. On connaît ces couleurs et on garde les mêmes couleurs. Même si les couleurs ne sont pas là, on garde.
Excusez-moi, Ousmane. Parlez un peu plus lentement et de façon plus audible. Il semble que les interprètes ont du mal à vous suivre pour faire l'interprétation.
Trop vite.
Ouais.
Tu m'as matérialisé avec le temps là qui file.
Désolé.
Merci, Brahma. I'm sorry.
Il faut élever la voix aussi, s'il vous plaît.
Oui. Ce que je voulais dire, c'est que on a défini un bulletin de vague de chaleur. bulletin d'alerte précoce vague de chaleur qu'on a conçu entre nous, le ministère de la Santé, et d'autres partenaires, comme l'environnement, comme les gens qui travaillent sur la protection civile, comme la Croix-Rouge. Donc, on a une équipe. Une fois qu'on a le bulletin, voilà un peu à quoi ressemble le bulletin. Ce bulletin que vous voyez, c'est un bulletin actif. Dernier bulletin, numéro 7, depuis qu'on a déclenché la campagne de vague de chaleur, donc qui a été issu le 1er mai et du 1er au 7. Donc, les gens connaissent très bien la portée temporelle. Et maintenant, on leur montre cette carte-là qui montre un peu où les vagues de chaleur et comment les vagues de chaleur sont sévères. On voit très bien que d'après la légende qui est en bas, on leur explique exactement ce que signifient ces couleurs-là. Et il y a des séances de formation qui ont été faites au niveau local et maintenant les gens comprennent. Ces couleurs ne changent pas. La légende qui est en bas ne change pas. Ces cartes gardent la même légende. Et vous voyez le pays, le Sénégal, les régions. Donc les gens savent exactement où se trouvent les vagues de chaleur et comment les vagues de chaleur seront intenses. Ça, c'est la première page en général de notre bulletin. Sur la deuxième page, maintenant, on essaye de traduire cela en action et d'expliquer aux gens maintenant ce qu'il faut faire, l'action. Donc, on voit très bien au départ, on rappelle un peu la carte, on résume, 2 lignes seulement, la carte que ça signifie. Après, on résume maintenant les zones, les régions qui seront impactées, n'est-ce pas? Et maintenant, les maladies, les personnes qui sont impactées, on les cite. Et on définit avec des pictogrammes, pas, des petits schémas qui permettent de comprendre clairement, n'est-ce pas, quelles sont les personnes à risque. On voit très bien que dans la deuxième, de droite à gauche, chez les enfants, femmes enceintes, les personnes souffrant d'une maladie, parce que la vague de chaleur, ça aggrave les personnes handicapées qui ne peuvent pas se déplacer, et les personnes âgées, bien sûr. Maintenant, qu'est-ce qu'il faudrait faire? Si les gens ne comprennent pas trop, il y a toujours des mesures assez simples, n'est-ce pas, qui peuvent être appliquées partout. Et ces mesures-là sont citées ici, 1, 2, 3, 4, pour dire exactement ce qu'il faut faire. En général, boire beaucoup d'eau, éviter certaines choses, etc. On les rappelle cela. Et maintenant, il y a un numéro vert. Un numéro vert où les gens peuvent appeler. Quand les gens ont des problèmes, on est en vague de chaleur, les gens savent très bien que quelque chose peut arriver, il faudrait qu'il y ait ce numéro-là à porter. Donc, quand il y a des problèmes, ils peuvent appeler et les gens pourront les aider facilement. Et en fin de compte, dans le bulletin, on montre, n'est-ce pas, cette probabilité de vague de chaleur-là. Maintenant, ça, c'est purement température, n'est-ce pas, quelles sont les zones qui sont touchées en matière de vague de chaleur et ça peut aller, là où ça peut aller. Parce qu'on a pensé qu'au-delà de la santé, il y a d'autres secteurs aussi qui ont besoin de cette prévision-là de température, n'est-ce pas? Le commerce, par exemple, on sait que les marchés en plein air, les marchés hebdomadaires, comme on les appelle chez nous, ont besoin de ça. Il y a beaucoup de businessmen qui, vraiment, en cas de vague de chaleur, ils ont un manque à gagner. Donc, c'est important aussi que le bulletin puisse les servir. C'est pour cela, maintenant, cette partie-là, ça montre la température, exactement quelle est la température qui est attendue durant cette période-là. Et on leur demande un peu, on leur donne une idée de cette température combinée avec de la vapeur d'eau, pas combinée de la vapeur d'eau. Donc, ce bulletin-là, c'est notre bulletin vraiment qui est là et qui est diffusé partout. C'est diffusé sur tous les médecins des districts. Une fois qu'on fait le bulletin, nous, on a notre propre réseau. Ensuite, la santé a son propre réseau, donc tous les hôpitaux ont ça, donc se préparer, parce qu'ils disent qu'en général, quand il y a des vagues de chaleur, il y a plus d'admis à l'hôpital, les gens viennent d'à plus. Il y a certains médicaments qu'ils ont besoin, etc. Ils doivent organiser comment recevoir les patients. Donc, c'est important que les médecins le reçoivent. On a un courrier à part. Aussi, quand on a fait, au niveau de l'ANACIM, on a aussi utilisé le réseau qu'on avait déjà développé. Ici, ça montre un peu le réseau, les différents types de canaux qu'on utilise pour envoyer l'information climatique. Bien sûr, on est présent au niveau en ligne, où on envoie, n'est-ce pas, sur les réseaux sociaux. Donc, on a une page de réseaux sociaux. On le dit dans le bulletin de la télé, quand il y a des vagues de chaleur, on le précise. Quand il y a le bulletin de la météo passe à la télé, on le précise aussi. On envoie des messages, des textes-messages, des SMS qu'on envoie. Ça veut dire qu'il y a des vagues de chaleur, il y a des personnes, pas des personnes, il y a des organisations qui sont ciblées. On les envoie des textos pour leur dire attention, on est en période de vague de chaleur, voilà un peu ce qui est attendu. Bien, ce qu'on a développé, et ça c'est basé un peu en faisant notre système d'alerte précoce avec les agriculteurs, on parvient à envoyer des messages vocaux. Ça c'est important. On est présent aussi dans les réseaux sociaux. Il y a des groupes WhatsApp qui existent, n'est-ce pas? Et nous, on s'est branchés sur ces groupes-là pour les envoyer. Il y a ce qu'on appelle des badjanogor, je ne sais pas si ça existe chez vous. Mais dans le programme de limitation des naissances, l'État avait développé des réseaux, n'est-ce pas? Des personnes, des femmes en général, n'est-ce pas? Que les gens ont confiance et qui vont donner des conseils. Donc, ça existe déjà. C'est un réseau vraiment bien huilé gérés un peu par la santé. Tout ce qu'on fait, on s'est graffé sur ces réseaux-là et on les envoie l'information, ils sont capables. Il y a aussi les associations, n'est-ce pas, sportives. Je ne sais pas au Sénégal, durant la période de canicule, en ce moment que les gens organisent ce qu'on appelle chez nous les navetans. C'est des matchs entre villages que les gens organisent. Même pas villages, entre quartiers, etc. Et c'est quelque chose de très populaire. Et les gens font beaucoup d'entraînement, les jeunes, comme vous le savez. Et il y a beaucoup de cas maintenant qui sont là. Et nous, on a pu se mettre ensemble avec ces gens-là et les envoyer l'information. Et le résultat, c'est qu'ils ont décalé même les heures d'entraînement pour s'accommoder, n'est-ce pas? Donc, voilà un peu une rencontre qu'on a fait avec ces Badjanu Gox au niveau local. Ça, c'était à Fatick. On se rencontre avec eux, on discute. Donc, quand on va au niveau local, on essaye de voir qu'est-ce qu'ils ont comme réseau. Qu'est-ce qui existe? Essayer de voir comment faire pour se brancher par rapport à ça. Donc, ça, c'est une discussion entre nous et la santé. Nous étions déplacés au niveau local pour voir ce que les gens font. Maintenant,
merci Ousmane. Vous pouvez rapidement conclure, s'il vous plaît. Merci.
Donc, voici la conclusion. Donc, ce qui est intéressant dans la conclusion, c'est que faut allier la vulnérabilité avec une prévision de risque. Et maintenant, savoir, il y a beaucoup de cibles. Il y a les longs termes, les planifications à la terme, les constructions, les autoroutes que les gens construisent, les villes que les gens veulent développer. C'est important qu'ils prennent en compte cette vague de chaleur. Les prévisions saisonnières. Nous, chaque fois, on ouvre une campagne de vague de chaleur pour marquer qu'on est dans la période où les gens se préparent. Et il y a maintenant cette prévision journalière-là qui se fait pour permettre un peu aux gens, n'est-ce pas, surtout les éleveurs qui se déplacent. Nos éleveurs sont nomades, transhumances. Il y a beaucoup de transhumances importantes qui se déplacent. Les écoles sont très importantes. La dernière vague de chaleur qu'on avait faite du 1er au 2 novembre, quand on l'avait annoncé, il y avait des élèves qui étaient tombés en syncope dans des classes à cause de cette vague de chaleur-là, ce qui a permis même au gouverneur maintenant de donner beaucoup plus de confiance à ça et on est en train de développer. Donc, ce qui est important, c'est vraiment cette synergie-là, mais ce qui est important, de donner un produit que les gens peuvent utiliser. Et il y a beaucoup de canaux qui existent. Il faudrait vraiment utiliser ces canaux-là et de se dire qu'on est dans un régime de changement climatique. Donc, ces vagues de chaleur vont augmenter en intensité et en fréquence. Merci beaucoup.
Merci beaucoup Ousmane, c'est vraiment gentil, très très bonne présentation qui nous montre un cas concret après qu'on ait vu tous les exemples de la théorie à la pratique. Cela étant dit, nous sommes déjà à bientôt 10 minutes de la fin formelle de notre panel, donc nous allons nous accorder 10-15 minutes pour les questions et réponses. Il se trouve que nous avons déjà eu des questions en ligne qui ont été répondues. Donc, nous n'allons pas forcément revenir sur les questions qui ont déjà eu des réponses. Nous allons juste tabler sur les questions qui restent, qui n'ont pas eu de réponse, afin que tout panéliste qui peut répondre à ces questions puisse y répondre. La première question qui est encore en ligne, c'est celle de Yakibe Josué. Il dit bonjour, le changement climatique pose un problème sérieux en Afrique et particulièrement au Tchad, entraînant des décès de sujets âgés jusqu'à saturer les morgues. Quelles précautions dispose l'OMS pour les années suivantes? Voilà. De quelles précautions dispose l'OMS pour les années suivantes? Je ne sais pas qui peut répondre à cette question. Si Dr Tizé veut s'essayer à cette question. Autrement, Dr Tizé, est-ce que vous pouvez répondre à cette question ou je peux donner quelques mots autrement?
Yes, thank you very much. So what the WHO is doing currently is that we are working on cross-departmental climate health working streams. As I mentioned, we have the WHO-WMO joint office here, and we are closely working with the regions. Even though it's long, there's a short, medium, and long-term plan. The long-term plan is that we are going to provide a guidance, working with the Euro colleagues, a global guidance on heat waves. In the short term, we are producing the readiness checklist with anticipatory actions. What is good is that we are closely working with the Afro readiness colleagues and preparedness colleagues. And these tools should be ready in the short term of 2 to 3 weeks. 2 weeks minimum, and the tool will be ready. So for immediate actions, because a lot of member states are facing this challenge, we need to provide a solution. And the Afro team, in collaboration with the HQ, will be providing a checklist with anticipatory actions that is adapted to the context of either Chad or any other member states. Thank you, and over.
Merci beaucoup. Je vais rapidement ajouter à ça, avant de donner la parole à notre ami Gigma qui veut apporter un avis, une contribution hors OMS. Je voudrais rapidement rappeler aux panélistes que nous agissons à 2 niveaux. Le premier niveau, c'est celui des urgences, lorsqu'on a une vague de chaleur. Et là, nous avons le service des urgences qui est le premier à prendre le relais et à aller de l'avant avec les actions concrètes sur terrain pour appuyer les pays. Mais dans cette composante urgente, il y a une composante préparation aux urgences. Et c'est dans la partie composante préparation aux urgences que l'équipe changement climatique de l'OMS contribue le plus. Comme vous le savez, depuis la COP26 2021 à Glasgow, il y a une initiative qui a été lancée pour construire des systèmes de santé résilients et à faible impact carbone. Résilients au changement climatique et à faible impact carbone. La première composante de cette initiative, c'est de soutenir les pays pour mesurer la vulnérabilité et l'adaptation des pays au changement climatique. Et dans cette composante, évaluation de la vulnérabilité et l'adaptation au changement climatique, il y a un regard qui est porté sur la question des vagues de chaleur. Pour les pays qui sont exposés le plus aux vagues de chaleur, la composante vague de chaleur doit faire partie de l'analyse de la vulnérabilité et de l'adaptation. De telle sorte qu'à partir de ce document d'analyse, d'évaluation, on puisse produire ce qu'on appelle les plans nationaux d'adaptation du secteur de la santé. Et ces plans nationaux d'adaptation du secteur de la santé intègrent des composantes liées donc aux vagues de chaleur. Vous avez entendu parler de systèmes d'alerte précoce. Les systèmes d'alerte précoce qui sont construits sont faits en anticipation aux vagues de chaleur. Et ils font donc partie des plans nationaux d'adaptation de la santé au changement climatique. Donc voilà un peu comment on travaille au niveau de l'OMS. Il y a la partie urgence, où c'est nos amis des urgences qui sont au devant. Et puis il y a la partie préparation, qui est faite en collaboration avec nos amis des urgences par l'équipe changement climatique et santé de l'OMS. Et on continue à faire le plaidoyer pour que tous les pays qui ne se sont pas encore souscrits à l'initiative santé de la COP26 puissent venir à bord de cette initiative-là pour qu'on puisse les soutenir en tant que OMS. Donc cela dit, je laisse donc la parole à Gigma pour nous dire rapidement quelques éléments avant qu'on ne passe à la question suivante. Quelles sont les précautions dont on dispose pour soutenir les pays pour les années à venir? À vous, Gigma.
Oui, merci. J'allais dire qu'également au niveau, par exemple, de la Croix-Rouge, on a à peu près le même système. On a ce qu'on appelle le système d'urgence et puis on a le système long terme. Alors, dans le système d'urgence, il est prévu de développer un certain nombre de ce qu'on appelle des protocoles d'action précoce. Donc, sur la base de ce que les systèmes d'alerte précoce disent comme alertes qui vont venir, il sera possible que la Croix-Rouge de chaque pays, donc la Croix-Rouge du Tchad, par exemple, mettre une série d'actions concrètement sur le terrain juste avant l'occurrence de la vague de chaleur. Comme je le disais, peut-être en février ou en mars, elle met en place un ensemble d'actions qui sont destinées à aider les populations à réduire au maximum les impacts de la chaleur sur elles. Au plus long terme, comme je le disais, on a une initiative actuellement qui est en train de prendre forme, une initiative conjointe de la Fédération internationale de la Croix-Rouge et de USAID, qui va également essayer de développer une grande politique d'adaptation à la chaleur extrême en Afrique. Pour le moment, il n'y a pas encore de contenu, mais il est attendu que dans les prochains mois, il y ait plus de clarité. Et je pense que les pays du Sahel, donc y compris le Tchad, seront l'une des zones les plus qui recevront le plus d'efforts de cette initiative.
Merci beaucoup. Merci beaucoup, Gigma, pour cette contribution. La deuxième question que je vais lire maintenant pour la traduction dit ceci. Bonjour. Elle est posée par Michel Mbandibaye. La question c'est bonjour, merci pour le thème abordé qui est d'actualité. Au Tchad, nous ressentons jusqu'à aujourd'hui un coup de chaleur extrême atteignant 47 degrés à N'Djamena, 44 degrés à Mundu. C'est vraiment pratique. Qui dit chaleur sous-entend aussi l'eau. Comment faire? Planter des arbres, boire abondamment d'eau, mais ne marche pas. Que cette formation sur la chaleur soit donnée aux volontaires de l'OMS pour aider les réfugiés déplacés et autres. Merci. Donc, c'est plutôt un commentaire. Je pensais que c'était une question, mais je pense que c'est plutôt un commentaire qui est fait. Il suggère que cette formation-là soit donnée aux volontaires pour aider les réfugiés. Et cela est donc bien noté. Merci beaucoup, Michel, pour la question. On a Josiane Marie Chantal Sawadogo qui dit quels sont les éléments de système de refroidissement de deuxième génération? Alors, cette question, je ne sais pas auquel de nos présentateurs, de nos panélistes, la question doit être adressée. Quels sont les éléments de système de refroidissement de deuxième génération? Dernière question que j'ai dans le chat, c'est une question en anglais. Donc, the last question in the chat is from Jean Bosco Ramazani. The question is, the question of heatwaves is already integrated into One Health. So it's asking if the question of heatwave is already integrated into One Health. So these are the two remaining questions. I can see Nicola is then answering to the question of Josiane. I guess the question was for him, but as it was in French, he didn't get it. So he got now the translation and I can see he's typing. So the remaining question is then the one from Jean Bosco Ramazani. Is heatwave already integrated into One Health? I don't know if one panelist want to jump on it. If not, I can give few comment on it. And yes, Jean Bosco Ramazani. The question is One Health. As you know, One Health is normally, basically at the beginning, is an approach that is supporting the consideration of health issues at the interface between human and animals. So you may see some of the health issues, some of the diseases that may be affected by temperature and by heat wave. So if you are tackling any disease, any health concern that is at the interface of health, of human health and animal health, but that is correlated to heat and to heat wave, yes, for sure, you may have to consider the One Health approach in tackling this health issue. So this is what I could say. As a methodology, is just need to know what are the factors that are contributing to the health issue. And if temperature and heat wave are contributing to this health issue, yes, for sure, we will be moving forward with our One Health methodology by considering heat wave and its impact on the health of communities and human and animals. I hope this is helpful. And I can see another last question that is coming in the chat before we may give 1-2 minutes of the floor to any live question. The question is in French. Quel rôle pour la géo-ingénierie dans l'adaptation à la chaleur extrême? Quel rôle pour la géo-ingénierie dans l'adaptation à la chaleur extrême? Je pense que cela a un rapport avec la présentation de notre ami Guigua qui parlait justement des matériaux de construction de nos habitations. Donc, je vais lui laisser la parole. À vous, Guigma.
Oui, je pense que la question de géo-engineering en anglais, pour être plus sûr, est très centrale lorsqu'il s'agit de répondre aux chocs climatiques, aux chocs engendrés par les vagues de chaleur. On sait que certaines vagues de chaleur, peut-être qu'on n'est pas rentré dans les détails de la météorologie des vagues de chaleur, mais on sait que certaines vagues de chaleur sont associées, par exemple, à une réduction de la couverture nuageuse. Donc, il y a moins de nuages lorsque les vagues de chaleur, lorsque certaines vagues de chaleur se produisent. Dans ce cas, par exemple, l'utilisation de l'énergie solaire, par exemple, peut se présenter comme une alternative idéale à la question de vagues de chaleur. Il y a également l'utilisation de l'humidité. Donc, certaines vagues de chaleur viennent en revanche, par contre, avec de l'humidité. Et lorsque cette humidité est importante dans l'enceinte d'une salle, je sais pas moi, d'un grand bâtiment, par exemple, il existe également des outils qui permettent d'extraire cette humidité-là sans forcément utiliser des climatiseurs pour refroidir la salle. Donc, dépendamment de l'aspect spécifique des vagues de chaleur auquel on est en présence, il sera possible d'utiliser une solution de geoengineering pour pouvoir réduire, on va dire, l'exposition ou plutôt la vulnérabilité des populations. Les solutions existent, on va dire que c'est plutôt du cas par cas, mais il est clair que le geoengineering va jouer un rôle central dans la réponse ou dans les solutions que nous avons contre les vagues de chaleur.
Merci beaucoup, Guigma. Il faut rappeler que cette question était de Dr Ernest Dabiré de l'OMS. Merci beaucoup, cher Dr Dabiré, pour la question. Et merci encore à notre cher Guigma pour la réponse. Cela dit, je vois une main qui est levée depuis. Comme c'est la seule main levée, avant d'aller à la conclusion, on va donc donner la parole à cette main levée. I can see Yeman Kibre. Your hand was raised so far. We are already out of time and we still have to close, but I can give you in 1 minute if you still have something to say, 1-2 minutes maximum, and so that you may let us know what you want to say. I can also see Ajak Peter, who just opened his mic, but please let's hear firstly from Yeman Kibre. And if any remaining time, we don't know what Yeman will be saying, we can give you the floor, Ajak. So Yeman Kibre, your hand is raised since a while now, quite a while. Do you want to say anything, please?
Yeah, thank you very much. I'm Jack Peter Yuan from South Sudan. Mine is the few clarification about the heat waves. Since you understand, South Sudan is one of the area hit by heat waves, of which now it has gone now 2 week time. The first one was the first phases. As working.
We can't hear you, fortunately. Ajak.
Non-governmental organization.
Ajak, can you hear me?
Related to
Ajak.
Yes.
We can hear you. We can hear Ajak. So unfortunately, we can hear him. So it's difficult for us to continue because we can hear him. Yeman, are you still around and do you want to talk? Yeman Kibre. You can unmute yourself and go ahead, please, rapidly. So I think I'm not sure Yeman wanted to say something. Maybe it's a mistake from his side. And very last one coming at the last minute, Henri, please go ahead rapidly, please. Unmute yourself and go ahead. Henri John, you are muted. Okay, wonderful. So colleagues, let's go now. Very, very nice roundtable webinar with almost 200 participants. Let's go now to the closing remarks of our session. To do so, I will give the floor to my colleagues, Magda and Alice. Please, can you help us wrap up rapidly on the key takeaway And the next step, Magda, please, and Alice will maybe give last thanks to our attendees. Over to you, Magda.
Hello, colleagues, and many, many thanks. I hope I am audible.
Yes, sure.
Yes, I have totally enjoyed the discussions. As we come to the close of this discussion, on behalf of the two emergency directors, emergency preparedness and response, and healthier population, I want to truly thank the panelists and the participants who have been with us for the last a little over an hour and a half. We really have understood what we came on board first, not really understanding. We have been educated on a number of things. We now truly understand that heat waves are not an event in isolation, that they're truly scientific in nature. We've been told the extent of which that can cause mortalities and morbidities in different vulnerable populations. We have been informed about how we prepare and be ready for response when we do have a heat wave event. We also have been told or been briefed on some of the ongoing response mechanisms that are around that we're able to tap into. And then finally, we have a great opportunity to be exposed to several experts who have brought their background and their seasoned knowledge to unpack a phenomena that is not easily understandable to all of us. Because of this heat waves, we see that our communities are bearing the brunt of soaring temperatures. They're experiencing profound disruptions to daily life, agriculture, and essential services. The vulnerable among us, including children, the elderly, and those with limited resources, are disproportionately impacted, amplifying existing inequalities and vulnerabilities. I therefore see, and I'm sure with a sense of apprehension to all of us, that this is a profound sense of urgency and responsibility in the face of the escalating heat waves sweeping across Africa, and indeed globally, I dare say, from some of the examples that we saw. These extreme weather events not only pose an immediate threat to lives and livelihoods, but also underscore the urgent need for concerted action to address the root causes of climate change. We have learned a lot in this little time that we have spent together. What this means for all of us who have been participants is that in the face of this crisis, we have to prioritize proactive measures to mitigate the impact of heat waves, including strengthening early warning systems, we heard that, enhancing community resilience, and ensuring access to life-saving resources such as cooling shelters and potable water. It was interesting, the response from the participants on what do we do in this day and age? What are the technologies that can help us to cool down faster? Very interesting. The reason why we have a panel that have a lot of experience and their informations are going to be made available to all of us, that we can continue the discussions with them even as we move on. It doesn't actually stop there. We have to come together, really home in a bit more on the early warning systems, enhance community resilience, ensure access to life-saving resources as shelters. Also, we have to redouble our efforts to reduce greenhouse gas emissions, both regionally and globally, to help the intensity and frequency of heat waves in the future. I call upon all of us. It has been a very interesting discussion because I see that we had a number of people from all walks of life. We have government members, in the participation. We have civil society organization representatives. We have a large number of technical and international communities who have joined us today. It tells us two things. The first one is the heat wave is really of concern, and all of us want to be able to do something about it. The second thing also, it tells us that there's actually a lot of appetite for increased awareness on information on how we deal with it. And therefore, over 200 people in a seminar like this means that we do have a sense of urgency to come together, collaborate a bit more to ensure that we continue the awareness and begin to unpack the response of the options that have been given to us for the African continent. Let us not wait for another devastating heat wave to take action. The time is to act now. And I thank the interest and the participation so far that has happened. We understand from our seasoned experts that we can actually mitigate the impacts of heat wave and pave the way for a more resilient and sustainable future for all Africans. As we close, please note for all of us who have been around the table that we are able to share the contacts of the seasoned experts, we're able to share the presentations, and then we remain also at WHO for any further questions that will come from the communities. I thank you for the insightfulness that this has brought to all of us. I came in just as late as the majority of you, and I'm going home a bit richer. I do hope that this does not, this is just the beginning of perhaps a lot more series that are coming on. Even as we close, I want to say that there are a series of discussions and webinars on heat waves that's flying around. Tomorrow, the Red Cross and another group will also be presenting on a third part of the heat wave scenarios. I encourage all of you, and we will share the presentation, to keep talking. We have learned from Senegal that it is possible to actually intervene and to intervene properly. We have examples, we have pictures, we have contacts. All these become a wealth of information that we can tap into right now on the Africa continent to ensure that we're able to do that. For the panelists, I thank you one more time and say I look forward to future engagements as we help the African continent to map out the various steps that will help us to combat or contribute a bit more efficiently to the heat wave events. Thank you very much, and back to Dr. Kondo.
Thank you so much, Magda. And I think before closing, we will kindly request all the panelists to open the video so that we can take a closing global picture of all of the panelists. And thank you, participants, for joining. Yes, we will keep connected with you. Nicolas, can you open your camera, please? Alice. Thank you, Matthew. I think we have all the cameras open. Let us take just one picture. And yes, this one seems to be registered. Let me take a second one. And I think it's now wonderful. We made it. Great. So thank you, colleagues. Thank you for making time to join. Thank you, Wasila. It's really yearly in USA, but you made it possible to join us. Thank you to all of you, Nicola, Matthew. It was great. Let us keep connected. We have a work to do. As you can see, there is a challenge for all of us here together around this table. And let us keep moving together, as Magda said. We will remain connected with you and try to see how we face those challenges coming on in our region. Together, we will make it. Thank you again, and take care of you.
Thank you, Brahma. Have a good day.
Thank you, Brahma.
Bye-bye.
Thanks, bye.
Good to see everybody.
Thank
Hello,
you.
Wasila.
Thanks, everyone.
Bye.
Thank you. Bye.
Bye-bye.
Thanks for
Thank you
inviting
all.
us.
Bye-bye.
Bye.
Bye.